Greetings from Orchid Fertility Clinic. We often get queries from our patients asking that what actually happens during an IVF cycle. So as we all know, IVF means in vitro fertilization, wherein we fertilize your embryos outside your body. So the whole process starts by taking injections from cycle day 2, and these injections are continued for an approximate duration of around 12 to 13 days. During these 12 to 13 days, we conduct some follicular scans to see if the follicles are growing adequately, and we also do conduct some hormonal blood tests to make sure that your hormones are also equally responsive to the hormones that you are taking. After 12 to 13 days, when the follicles have attained their maturity, we then harvest those eggs out by offering you a short sedation or an anesthesia, and it lasts for 30 minutes. And during those 30 minutes, we harvest all the eggs out, and then we fertilize the best matured eggs with the sperms, hoping and praying that it fertilizes. So your stay in the clinic would be for approximately around 2.5–3 hours, and then you can go back home. The next day, when we have checked if the fertilization has happened, then these embryos are cultured in the lab for the next 5 days, and the day 5 embryo, which we call is a blastocyst, can be either transferred back into the uterus or it can be frozen to be transferred at a later date. For more inquiries or for more questions that you have, you can feel free to reach out at Orchid Fertility Clinic. We are here to take care of your fertility needs.